All right, it's official. West Virginia today taking a huge step towards a healthier America, being one of 6 states to have its USDA waiver signed, sealed, and delivered, removing junk food from its state SNAP benefits.
And this comes as about 1 in 6 West Virginians, that's roughly 277,000 residents, rely on SNAP for food assistance. West Virginia Governor Patrick Morrisey was alongside Secretary Brooke Rollins today for the big sign-in, and he joins us now to tell us more about keeping West Virginians healthy, making them wealthy and healthy. All those things are pluses in your state. You're a net exporter of energy, but now you want to import health for your constituents. Why, Governor, do you take this next step?
Well, I think it's so important. First of all, thank you for covering this important issue, because I think so many of us are focusing on improving healthcare outcomes in our country. And finally, for the first time in a long time, we have a president, Donald J. Trump. We have cabinet secretaries in Brooke Rollins and RFK that are trying to move the needle, because whether you're talking about SNAP, whether you're talking about trying to get the crap out of the food, or exercising, or finding purpose in the life, they're doing so many things to start to make a difference on some of the tough disease states that we have, whether it's diabetes or obesity or congestive heart failure. In West Virginia, unfortunately, we've led the way in those categories. This is the beginning of a way we get to turn it around and get our people and our country healthier again.
Governor, I want to focus on sugar specifically. You mentioned many diseases. The root cause is sugar. And also the SNAP benefits, which are taxpayer-funded benefits. I read one study from Brookings that said 5 to 10% of those benefits are used for soda alone. That doesn't include the rest of the sugary drink category. That could take it up to 20%. That's a substantial amount. These benefits are meant to provide proper nutrition. So when you're using the money for sugary drinks, you're not getting the vegetables, the fruit, the protein that you need.
That's right. Well, that's exactly right. In fact, there's a reason why the program's called SNAP. It's supplemental. That means additive to what you normally have. Nutrition assistance program. So first of all, we're going to get the punch back into nutrition and not have taxpayer subsidies for soda, because there's no nutritional value within them. And we're going to eventually look for some of those healthy choices in terms of the kind of proteins that people want to have, the vegetables that they want to have. And I think having the SNAP program evolve is going to ultimately help lead to better healthcare outcomes for our state and for our country. So we look at this as a big win today. And when combined in tandem with some of the efforts to do work requirements and to renew purpose in one's life, we think that this administration is doing some pretty important things to help people get healthier again.
And, you know, Governor, I might add, with the president reinstituting the Fitness Council, the childhood obesity rates, added that to a health approach. You, sir, are a rock star for what you're doing for your state. It's a model for all states.
Well, I'm going to just add one more plug for West Virginia. We're doing the Mountaineer Mile, and we've put Mountaineer Miles, this walking trails, in every one of our 32 state parks. It's a great way for people to get out and exercise and do at least a mile a day. Since RFK and I shared the stage back in March, I've done it every day. We're trying to do over 10,000 steps a day. It's the beginning of a process to get healthier. Much more in front of us, but it's terrific.
Amen. Governor Patrick Morrisey, thank you.
Thank you.